Bethesda Clinic started back in 2003. It was basically the community coming around to say, how can we provide medical and dental services for our working uninsured neighbors? We had a lot of people who had basic health needs, and they were struggling trying to find a place to go to get those needs. And so we had the church community, the medical community, kind of rally around and try to come and make a community effort to do that. We can do anything that a primary care office can do, but the really cool part is because of our community volunteers, we're able to do specialty services. So things that people would have to go generally see a specialist for, they can see down here, like orthopedic and stomach issues, GI procedures. We can do basic dental care, so getting people out of pain and suffering and helping in their just appearance sometimes with the front teeth that might be missing. Bethesda is 100% community funded, which is amazing when you consider what all's done here. We have our patients pay a small copay, but they help cover about 1/3 of our fees with doing that. And the other 2/3 of our fees comes from our communities, either through our special events, through just our donors who give monthly and regularly to the clinic, and then also our 2 thrift stores, our Hangers of Hope stores that started about 5 or 6 years ago. But everything that's donated through there helps generate income to come back to the clinic and goes directly to the patients that we see.
Bethesda has worked through a way of making healthcare affordable. And so we know going in what it's going to cost the individual patients. They've thought about it, they've dealt with it. It's not a free ride, everybody pays something, but they know what they can do. It's something that's affordable to them.
Our general copays are either $20 or $30, but patients, just as if they had a HMO or a PPO or some kind of insurance plan, they make a small copay. They make a small payment to be seen, but they know what it is before they get here. And the cool thing is they get to invest into their own health care. And they make that investment, and then the community comes around and pays for that other 2/3 of the cost of those visits. So, and that's why we're grateful to have all the support, but it's also why we're grateful the patients are grateful because they are able to be a part of their own health care.
This place has been more than good to me, you know, I mean, compassionate, loving people, staff that you have has been very patient with me and helpful.
We like to see the patient as a whole person, and so we like to minister to them both in their physical care, which we have our medical outcomes are as good as any in the country, and so we're able to provide top quality service there, but we also are concerned about their mental health, and so we provide counseling services, other ways of screening people for depression and anxiety, and then also their spiritual care, which is the biggest of all in our mind, that so many people are struggling spiritually, and so that we have both our staff and our volunteers are able to minister with our patients. We can pray with them, we can hear their story, we can see them as a whole person.
Hats off to Bethesda. They've created a system that really works, and it works for all of us.